Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering the neurological system, but to be specific, I'm going to be covering the drugs that are administered in the neural system. So guys, before I even get started, you know what I'm going to say, please don't forget to like and subscribe below. That's how you can support this channel. Don't forget, I have audio lessons available on my website, nexusnursinginstitute.com, and make sure you check me out on TikTok and Instagram, where I cover questions every day. Here on YouTube, you get it once a week, but TikTok and Instagram, every day I do 3 to 5 questions. So if you want to keep that content going, you can go ahead and check that out. And don't forget, for my nurse practitioner students or recent graduates, I do have a podcast for you. It's released every Sunday, 1 p.m., same day as time as my YouTube videos. You can find me on most of the major streaming platforms, and I also have my podcast available on my website as well. All right, guys, so without any further ado, let's get started. First question. The nurse should monitor a client receiving you guys know I can't pronounce, Mannitol for which of the following adverse reactions? 1, constipation, 2, decreased heart rate, 3, hypertension, or 4, increased intraocular pressure. And guys, the correct answer is 2, decreased heart rate. Now, this medication, Mannitol, guys, this is a cholinergic drug, and it's often used to treat glaucoma. So the correct answer is 2, decreased heart rate, but also it can cause decreased blood pressure, diarrhea. Now, there's something I want to point out to you guys. Whenever you guys get a question that says adverse effect, this is what I want you to be thinking. Number 1, adverse effect is different than side effects. So, very often you'll see them used interchangeably, but they're not the same. Side effects are things that may happen that you're going to warn the patient, hey, just so you know, this may happen. You tell them in advance. You don't want them to stop taking their medication. But adverse effects are things that may happen, but if it happens under any circumstances, you need them to call the doctor right away. Okay, so that's the difference between side effect and adverse effect. That's number 1. Number 2, when you're thinking of adverse effects, one of the things I need to go in the back of your mind is you need to think to yourself, well, what happens is the medication works a little bit too well. So I'll give you an example. Let's say we were talking about insulin, right? Well, the goal of insulin is to bring down the patient's blood sugar. But what happens if that insulin works a little bit too well? Hypoglycemia. Patient can have a hypoglycemic reaction. Which one's worse, hypo or hyper? Hypoglycemia, right? So that's a sign of an adverse reaction. So I want you to kind of think about that whenever you're seeing questions asking you about an adverse reaction. If you have no idea what the adverse reaction is, think to yourself, say, okay, well, what does this drug do? And what can happen if it works a little bit too well? Okay, and when it comes to this medication, I'm bringing it back to that medication, Mannitol, which again, guys, is a cholinergic drug. Besides the decreased heart rate is bringing everything down, what else can happen? Decreased blood pressure is bringing that blood pressure down, and diarrhea. All right, guys, next question. The nurse should assess which of the following after slowly administering Lorazepam Ativan IV to a client who's been experiencing seizures in rapid succession. 1, tachycardia, 2, hypertension, 3, tissue hypoxia, or 4, respiratory depression. I know it's not Christmas, guys, but I love this mug. One of my students actually gave this to me as a gift for Christmas a few years ago. Okay, guys, and the correct answer is respiratory depression. And this is a great example of what I just was explaining to you back in the first question. Let's go back to this question. So it's talking about Lorazepam. What is Lorazepam? A benzodiazepine. Okay? What's Ativan usually given for? To decrease anxiety. So it's given to bring everything down. Right? Bring down that CNS. Well, what happens if it works a little bit too well? Respiratory depression. Do you see what I just did there? So guys, you don't always have to know the answer. There's certain tricks that you can use to still get to the answer even if you didn't know what it was, okay? A client's taken phenytoin dilantin 200 milligrams daily. The nurse monitors the client for which of the following adverse reactions? 1, diarrhea, 2, pruritus, 3, sedation, 4, hypertension. If you don't know the answer, guys, use the skills I just taught you to answer this, and the correct answer is 3, sedation. Let's go back to the question. So we're talking about Dilantin, which is a what? Anticonvulsant. So this is a medication that's what? Depressing that CNS, because those neurons are firing all over the place. That's why the patient's having seizures. So we're trying to slow it down. But what happens if that medication works a little bit too well? Sedation. You guys see what's happening? All right. Next question. The nurse infuses Dilantin with which of the following solutions to control seizures? And guys, you got to know this. 1, normal saline. 2, D5W. 3, lactate ringers. 4, D5W, half normal saline. Excuse me. All right, guys. And the correct answer is 1, normal saline. When you're giving Dilantin, the only solution you should give it with is normal saline, because what happens, guys, if you give it with dextrose, it causes precipitates to form. So you're never going to give it with anything with dextrose. You want to only give with normal saline. That's why number 1 is the correct answer. Dilantin's been prescribed for a client. Based on understanding of the medication, the nurse caring for the client should 1, maintain Dilantin level 30 to 50, 2, dilute IV Dilantin with 5% dextrose, 3, administer good oral hygiene, or 4, give intramuscularly. And guys, the correct answer is 3, administer good oral hygiene. This is a famous test question. So if you already took pharmacology, I'm sure you saw this on pharmacology, and you'll see it again when you get to neuro, okay? This is something you absolutely have to know. When it comes to Dilantin, the patient can get, and this is an adverse reaction, by the way, they can get something called gingival hyperplasia. So it's very important when that patient is taking Dilantin that you perform good oral hygiene, you teach them to perform good oral hygiene, and you're constantly checking the gums because of gingival hyperplasia. Now let's look at our wrong answer choices. 1, maintain Dilantin level of 30 to 50. No, the normal level is about 7.5 to 20. Depending on textbook, maybe a half to 1 point out of range. But for testing purposes, guys, it's going to be way out of range, so you know it or you don't. But it's nowhere near 30 to 50. You're more I can't speak today, guys. The therapeutic level is 7.5 to 20. So that's wrong. 2, dilute IV Dilantin with 5% dextrose. Well, we know that's wrong because I just told you, 2 questions ago in the last question, that we only give it with normal saline. We don't want precipitates to form. That's why we don't give it with dextrose. So that's wrong. And number 4 is wrong. Give intramuscularly. We never give Dilantin IM. So that's incorrect. The nurse is caring for a client who's receiving phenobarbital for epilepsy. The nurse identifies the nursing diagnosis as high risk for injury related to unpredictable intermittent neurologic dysfunction. Which of the following is a priority to include in the client's plan of care? 1, consume alcohol in moderation. 2, drive a car only during the day. 3, lie down at the first sign of an aura. 4, increase fiber in the diet and fluids. And the correct answer is 3, lie down at the first sign of aura. Because what are we concerned about? Patient safety. So the minute the patient has an aura, first of all, what is an aura? An aura is a sign that it's the feelings, it's something neurological that patient either sees or feels or smells to let them know that they're about to have a seizure, right? So we want that patient to lie down the minute that they have the aura, because do you want a patient standing up when they have a seizure? No, they might fall and hit their head. Safety is our concern. So number 3 is the correct answer. Now let's look at our wrong answer choices. 1, consume alcohol in moderation. Are you ever supposed to take alcohol and medication? Absolutely not. So it's obvious that this patient is going to be on anti-epileptic drugs. How are they going to drink alcohol? I don't care if they said moderation or just a little bit. No, that patient needs to avoid alcohol. They need to stay away from alcohol. They cannot be taking any neuro, any psych meds, any meds, and taking alcohol at the same time. So that's wrong. Choice 2, drive a car only during the day. No, this patient should not be driving at all. They should not be driving. They should not be operating heavy machinery because we don't know when that patient can have a seizure. They should not be swimming alone. Even if they're taking a shower, what do you teach the patient? If you're bathing, have your wife or a family member in the home, door open, so in case you have a seizure in the shower, someone is there to help you. So they definitely should not be driving. That's wrong. And 4, look how they tried to trick you. Look how beautiful that is. Don't we always tell patients to increase fiber in their diet and increase fluids because it's healthy for them? It'll prevent them from getting constipated and all that good stuff. Well, that's wonderful. But what does that have to do with the patient's safety? Absolutely nothing. So the correct answer is choice number 3. The nurse obtains a subtherapeutic serum level for a client who's receiving Dilantin with seizure activity under control. Based on results of the Dilantin level, the appropriate nursing action is to 1, change the medication to Tegatrol, 2, increase the dose of Dilantin, 3, add phenobarbital to the drug, or 4, continue Dilantin as ordered. And guys, the correct answer is 4. Continue Dilantin as ordered. When it comes to seizures and epilepsy, guys, we always want to give the smallest amount of medication that is effective. Even if the amount of drug that we're giving that patient is a subtherapeutic level, even better, as long as that seizure is under control. Because remember one thing about these anti-epileptic and these anti-seizure drugs, the longer the patient has been on them, the more resistant their body will be to it. And so that means as time goes on, the doctors will only have to increase the dosage. Okay? So we always want to give the minimum amount that is effective. So that's why, because if you go back to the question, it says seizure activity under control. So even though it's a subtherapeutic level, that patient's seizure is under control. So we're going to keep it that way. The nurse is caring for a client who has a cerebral edema following a cerebral vascular accident. The nurse should understand that the client is to receive Mannitol IV for which of the following purposes? 1, inhibit prothrombin formation. 2, prevent platelet aggregation. 3, decrease intracranial pressure. Or 4, perfusion of occluded intracranial arteries. And guys, the correct answer is 3, decrease intracranial pressure. So let's talk about mannitol. What is mannitol? It's an osmotic diuretic. So think about it. The more fluid that we get rid of, what's going to happen to the pressure? It's going to go down. So that's why, number 3 is the answer, to decrease the intracranial pressure, because as that patient's getting that diuretic, by the way, guys, when I say osmotic diuretic, this diuretic is systemic. So what I'm saying is all that fluid that we get rid of, as that fluid goes down, so does the intracranial pressure. Which of the following would the nurse recognize as the appropriate rationale for the administration of the drug levodopa to a client with Parkinson's disease? 1, the drug activates enzymes to degrade dopamine. 2, the drug blocks the release of dopamine. 3, the drug provides precursor of dopamine. Or 4, the drug inhibits the synthesis of dopamine. And guys, the correct answer is 3, the drug provides the precursor of dopamine. So let's think about it. When you go back to the question, and it tells you that the patient has Parkinson's. What's the problem in Parkinson's? Does the patient have too much dopamine or not enough? Not enough. The problem in Parkinson's is the patient does not have enough dopamine, and that's why number 3 is the answer. It provides that precursor to dopamine. And guys, let's say you didn't know that the problem in Parkinson's was not having enough dopamine. Let's say you had no idea about that, right? Still, if you look at your choices 1, 2, and 4 all talk about dopamine being decreased, and choice number 3 was the only one that was the opposite, that showed dopamine being increased. So even if you didn't know what the answer was, just looking at the choices, you see that 3 has something in common, and one of them is the oddball. Choose the oddball if it's a multiple choice question. The nurse is caring for a client who's receiving Dexamethasone Decadron for a spinal cord tumor. The nurse should assess for which of the following adverse reactions? 1, hypoglycemia. 2, nausea. 3, constipation. or 4, hypotension? And guys, the correct answer is 3, nausea. Now, we're talking about dexamethasone Decadron, which is a what? It's a steroid. So some adverse reactions would be nausea, diarrhea, increased blood pressure, and what? Increased blood sugar. Because what do we know about steroids? They increase their blood sugar. They can cause GI ulcers. They can cause osteoporosis, fractures in the bones. What's the 4th thing? There's one more. Increased blood sugar, ulcers, fractures. Oh, and they mask the signs and symptoms of infection. Okay? So if for this question, the only one that is correct is 2, nausea. Like I said, besides nausea, a patient can have diarrhea, they can have hyperglycemia, and they can have increased blood pressure. Cogentin has been prescribed for a client. Based on an understanding of the adverse reactions, the nurse caring for the client should do which of the following? 1, inform the client that diarrhea is a common adverse effect. 2, instruct the client to drink alcohol in moderation. 3, turn and position the client frequently. Or 4, monitor the client for urinary retention. And guys, the correct answer is 4, monitor the client for urinary retention. So we're talking about cogentin. What is cogentin? It's an anticholinergic. It is often used to treat Parkinson's disease. Anticholinergic, remember the poem I taught you about anticholinergic? Can't see, can't spit, can't pee, can't. There you go. Why can't pee? Urinary retention. Why can't spit? Dry mouth. Why can't see? Blurred vision. Why can't? Constipation. Okay, so the correct answer for this was number 4. Now let's look at our wrong answer choices. 1, inform the client that diarrhea is common adverse. Nope, it's constipation. I just explained to you why. Choice number 2, instruct the client to drink alcohol. We know we are never going to tell patients to drink alcohol while they're taking medications. We're going to tell them to do what? Avoid alcohol. Choice number 3, turn and position a client frequently. This question said nothing about the patient being debilitated, being on bed rest, being bedbound. Why would we have to turn them? Why? So that makes no sense. So the correct answer is number 4, because we know with medications such as cogentin, which is an anticholinergic, an adverse effect is urinary retention. The nurse is caring for a client with myasthenia gravis who has become progressively weaker. Tensolon has been prescribed for which of the following purposes? 1, treat the client's muscle weakness. 2, differentiate between cholinergic crisis and myasthenic crisis. 3, increase skeletal muscle relaxation. Or 4, decrease difficulty in breathing. And guys, the correct answer is 2, differentiate between cholinergic crisis and myasthenic crisis. All right, so let's talk about it. If it's cholinergic crisis that the patient has, that Tensolon is actually going to make it worse. That muscle weakness will become even worse. But if it's myasthenic crisis that the patient has and they get Tensolon, that muscle weakness will significantly improve. Now, granted, it's only going to improve for a few minutes, 5-10 minutes tops, right? But just that will let us know which one we're dealing with. Are we dealing with cholinergic crisis or myasthenic crisis? So that's why number 2 is the correct answer. Oh, wow. This is a short video. I'm already down to my last question. Guys, if you want me to cover more questions on this topic, please be sure to leave a comment below and I'll make sure I make a part 2 for you. When providing care for a client who's receiving, you guys know I cannot pronounce, Ritalin, the nurse should monitor the client for select all that applies. Guys, how do we treat select all that applies? As true or false. Now, before I even get started, I want you to think, okay, Ritalin, what is that? That's a CNS stimulant. So we need to be looking for answers that speed things up, things that are going to go up. 1, constipation. No. 2, weight gain. No, if anything, they'd be losing weight. 3, tachycardia. Absolutely. That heart rate's going to go up. 4, nervousness. Absolutely. They're going to be like this. Their brain function is going to be like this. 5, gingival hyperplasia. No, you're thinking Dilantin. 6, palpitation. Absolutely. You feel like your heart's coming out of your chest. So the correct answer for Ritalin, as far as being something you'd monitor for, is tachycardia, nervousness, and palpitation. Guys, that's the end of this video. I hope that you found it helpful. Please let me know in the comments what you think, what you'd like to see more of. If you're a current student and you are struggling and you want to hear my voice in your head telling you what is important to know, what you're most likely to see on the test, what you better take a closer look at, go check out my audio lessons on my website, nexusnursinginstitute.com. If you want to get some extra studying in, be sure to check me out on TikTok and Instagram. My handle's still the same, Nexus Nursing. And don't forget about my podcast for my nurse practitioner students. Handle still the same, Nexus Nursing. Guys, you want to support this channel, please like and subscribe below and share my content with anyone you think it would be helpful to. Thank you so much for watching this video, and you'll see me on the next one.